It is a great honor to be among our colleagues, and a warm greetings to distinguished panelists and respected audience of this webinar. And a special thanks to the organizer of this event, the Center for Caspian Policy. It is indeed a pleasure and a privilege to represent Afghanistan at this virtual conference on COVID-19. As a fact of today, the international community, including Afghanistan, is facing the century's greatest public health threat, the COVID-19 pandemic, that recognizes no borders, has significantly disrupted the lives and overwhelmed the health systems and the governments. The ongoing pandemic has presented the country with its own unique challenges. Over the past few months, more than 300,000 Afghans have returned to the country from heavily infected areas, including Iran as the epicenter of the virus in this region. And this has exacerbated the spread of the disease across the country. This has also overstretched our already constrained healthcare delivery system. Today, more than 12,000 confirmed cases and 220 deaths have already been reported through the limited surveillance we have ongoing. Containing and combating the pandemic is a key priority of the government, and we're taking necessary steps to manage the situation timely and quickly. We have upgraded our health system, imposed lockdowns and restriction on movements, and closed education institutions to cope with increasing needs linked to entry screening, health messaging, contact tracing, isolation, and case management. An additional health workforce was also rapidly deployed in major population centers such as Herat, Kandahar, and Kabul. We thank our partners who have stepped in to help us rapidly scale up response efforts, particularly in establishing essential supply lines, expanding testing capacity, surveillance, and community awareness. Being in a protracted conflict for over 40 years, Afghanistan has an array of ongoing humanitarian and development crises that also requires urgent and continued attention. The impact of COVID-19 will have collateral effects on these ongoing crises, upending people's lives, increasing human sufferings, and worsening inequality. Now, the two major obstacles for combating the COVID-19 in Afghanistan is lack of cooperation for community and low testing capacity. As the level of education and health awareness at the community level is low, many community members show apathy for complying with the recommendations provided by the Ministry of Public Health of Afghanistan. We have placed our efforts to reach the communities through different approaches, including the involvement of religious leaders and community leaders. However, the effect of our intervention is still suboptimal. In addition, as Afghanistan is dependent on international assistance, we still look forward to increase our testing capacity in all Afghanistan. To meet our requirement in terms of testing capability, we look forward for receiving technical assistance to scale up our testing capacity from Caspian region. We believe that the fight against COVID-19 requires a coordinated response backed by global and regional solidarity. Extensive investment in research and development is crucial to produce an effective vaccine and treatment for COVID-19. We express our sincere gratitude to all partners who are standing by us in this difficult time for their continued technical guidance, provision of life-saving supplies and personal protective equipment, capacity building, surveillance, and support in establishing and expanding diagnostic capacity for the COVID-19 response. As we are already starting to see, unfortunately, the impacts go far beyond just health. Afghanistan will likely feel the effects on its economy, food security, and provision of social protection for years to come. Addressing these during and beyond the pandemic will be an uphill battle, difficult but not impossible if our regional and international friends continues to stand with us in solidarity. Mitigation efforts needs to happen now to minimize the repercussion for the worst and most vulnerable groups in the country, and this needs a much more comprehensive multilateral approach. At the end, I would like to reiterate to overcome the COVID-19 pandemic and elevate the health, economic, and social impact of the COVID-19 pandemic in this country and region. We need to establish a strong regional cooperation and coordination mechanism. We should exchange our experiences, assess and increasing the technical capabilities, conduct joint researches, and provide all kinds of significant support to the governments that needs it. Thank you very much.